the patient's doctor. And you have Sean. Sean is the nurse. Alright, he's going to help you with some of your tasks, which is good. He's going to act like a nurse, okay? So I'm first going to familiarize you to the environment. So this is going to be an immersive simulation, meaning you'll be here and you will be functioning as junior doctors.
Okay.
Alright, okay. So so I've introduced everyone in the room. Now I want to show you all your equipment, okay? So you've got the full range of airway equipment there. Alright, I don't think, basically, you don't have to open any of the trolleys. So if it's not there, it's probably not required in this scenario. Alright? Similarly, for the drugs and all that, is what's here. So with medication, okay, so if you want the drip, I'll show you how to connect the drip, okay, so we primed it for you. If you want to give any drugs, you know, there are labels here. You should try to find the correct label. But if it's a drug that's not labeled and you still want it, you can see there's take up any syringe. But I actually want you to draw it up. You're going to draw up, for example, if you want adrenaline, you're going to take the adrenaline in syringe, and I want you to draw up a 1 ml fluid. You know, if you want the 20 ml flush, you need to draw out the 20 ml flush and all that. Okay, which year are you going?
You just finished one.
Okay, so you're going to final year. Right, okay, fine. So yeah, so you know what I mean, like if you want to give like propofol, like I'm an anesthetist by background, yeah. So you just need to take a 20 ml syringe and draw up some liquid, right? It's okay if you don't know the exact volume that's required. I just need you to draw up something.
Okay.
Because if you just say it's much in real life, you have the drawing up takes up some of your. It is a task that needs to be managed and will occupy your time and will be your mental load, and that's why you need to actually do it for it to really be like a real environment. Okay? Alright, so yeah, so just this is the most important is to draw up. Any draw you want, you just need to declare though. Best is you declare what it is you're giving and how much, so that the patient can respond accordingly. Okay?
So declare and then draw up.
So you say, okay, I'm getting let's say adrenaline ready, and then you take it, and then when you're giving it, you need to say what you're giving it so that the patient can respond according to your management. Is that okay? Alright. Okay, there is a defibrillator here. This is a live defibrillator. So don't mock shock each other or anything like that with 200 joules, okay? This actually discharges real electricity. So you just need to know a few buttons. Are you familiar with this?
Can you just show us?
Yeah, I'll show you. Okay, this is okay. So you just need to, only a few buttons are necessary.
Hello.
Alright, okay. Yeah, so the on button. Okay, we just want you to play out with 2 joules. Okay, 2 joules, alright, so it's safe.
Okay.
Yeah, alright, okay, so, but you need to declare the joules that you want.
Okay.
Okay, so that's part of your management. Say, okay, I'm giving like 200 joules, right, okay. So by default, you will cite 200. So you need to press the arrow down and reduce it to 2. Anyway, Sean will be here. If you are you accidentally want to shot with 200, he will come here and he will switch it off. And he will say, yeah, so then that's the cue there, and then he will correct it for you. Okay? So you just need to on, energy select, because in real life that's what you need to do as well. Alright, okay? And then you can charge here, but actually you can also charge here. But you cannot deliver the shot here, yeah? This shot button is only for AED connected one.
Yep.
Alright, it's not for this one. But you want to try and take out the pedals? You want to try and take out the pedals? Because it's like a lot of defibrillator, you just yank it up. Yeah, correct, okay. Yeah, okay. So yeah, you can leave it, yeah, maybe we just leave it loosely like that so that it's easy to take it out. Alright, fine, okay. Yeah, okay. So yeah. So and then only the lead if you need to change the lead to pedals mode or anything like that, right? So basically you just need to do this one and this one, potentially this one or this one, but to deliver shot you need to press both pedals on this one. Is that okay? Yeah, alright, okay. So remember, if Sean switches it off, it means that the joules is too high and he will sort it out. But actually I want you all to do all this because in real life these are the things that will take up your task, okay? Alright, okay. So the bed. Alright, so that's the drugs. Okay, fine. Now the bed, okay, that's the cord side and the head is up. So I need to show you how to handle the bed as well. So okay, just look here, this lever. You see that's for the flat. Right? Okay, you want to flatten the patient, right? You can take out this one, right? Okay, okay, alright. So you can see the cue there, right? If you want to lower the bed, it actually needs to be pulled up before you be activated. This is to lower and increase the bed. If you are stuck, Nurse Sean will be very helpful. He will help you, but I actually want you to try to do it yourself. If you can. Alright, okay. So yeah, alright. Okay. Now let's go to the mannequin. Alright. So with the mannequin, his eyes can open, or half open or close. If it's open, it's a cue that he's fully awake. If it's half open, it means he's to be unwell. If it's closed, it means he's unconscious potentially or sedated. Right? Then if you he's supposed to respond like a real patient. So if he's not totally unconscious, if he closes his eyes, you call him, he would vocalize or open eyes or something like that. Right? The pupils don't react to light. So don't have to worry about that. You can do full airway works with this. You can put oropharyngeal airway, LMA, and all that. You can potentially re-intubate the patient. Alright, okay. In terms of you can hear breath sounds, right? Sorry, I'm gonna try. Are you familiar with this mannequin? Not really. Okay, that's why you want to have a listen. Yeah. Okay. Yeah. So you can hear breath sounds. Yeah, okay, you can hear heart sounds as well. Alright. Can you hear breath sounds? Oh yeah? Okay, no, they have on it, but maybe because it's not, they haven't Daniel, have you started? Just don't display anything yet, just start, have you started the make? I can hear, okay, fine, alright, okay. So you can hear heart sounds and breath sounds, okay? So, yeah. Okay. Alright, and then, are you okay?
Yes, sir.
Oh, you want to put it outside? Maybe put,
It's okay. We can.
I think it should be okay.
Barang-barang tu. You should go straight, right?
Okay, just be careful that you don't roll over it or something, yeah? Okay, yeah.
Sorry.
Maybe we should, can we have an usher to to keep it safely next door? Daniel, boleh come. Yeah, I'm just worried that we damage it or something. Yeah, just put it in a somewhere to store it. Okay, sure. Yeah. Okay, good. Yeah. Get yourself ready. Good. Alright. Okay. Yeah, excellent. Okay.
Thank you so much.
Okay, good. Alright. Okay, so you can do CPR.
Okay.
So you should follow the same. He's a bit difficult, so we won't be so strict about the depth and stuff like that if that is required. But the rest should be. You should compress it like a real person, right? If you want to shock the patient, only on the golden buttons, not anywhere else because it will burn the skin. Alright, okay. So just put. You don't need any gel or anything like that. Alright, okay. Okay. Pulse. You can feel both carotids. You want to have a feel? You can feel the femoral. That may be the easiest. That might be the easiest central pulse. More easier. If you can't feel, you can verify it here. Okay. What do you say, Daniel? Is it on? Because I can't feel the pulse.
Yeah, you want to start now?
No. I mean, don't display, but you can start. Yeah. So that there's a pulse. You can start the session.
Okay.
Yeah.
But I feel the soft.
Yeah. So okay. Now it's on. Okay, fine.
Nice.
Yeah. Can you feel the pulse? Yeah. Okay. Yeah.
We try the
Yeah. Alright.
I tried the one.
Okay. Alright. Okay. Central pulse, post carotids, and then can feel. Yeah. So the radial might be a bit harder. Yeah. Okay. Central pulse can feel. Okay. Alright. Okay. Okay, and then the IV access, okay, he's already got an IV access. So just ignore this one and ignore this wire. This is the drainage. When you run through it or whatever, it needs to go somewhere, it goes to the little bucket under there. Alright, so this is the clinical one. So use this like a clinical one. You connect drip here, you can inject here, right? Okay, alright, so and you can run the fluid. You should run it as fast as you would run it in the real patient. Okay, alright, okay. Yes.
Do we unscrew
The what? Yeah, you need so this is like real one, so when you need to.
do we actually pump the fluid?
Yes.
Okay.
Yes. It's all going to go down to this bucket. Alright, so just don't, this one is the one that we read for the, yeah. Any question, you can ask me that.
I was just trying to figure out how to.
Okay, yeah, so that's part of your critical management, okay, part of your priority and, demonstration, yeah. So, okay, so this is the trick, alright, is that okay? Okay, alright. Sorry?
Sorry, I have a question. How do we put the bed into CPR mode? Like, where is the...
You figure it yourself.
The CPR mode? No, just the liver?
But there's like a button to straight.
No, this is not the, this is not isolate, this is, this is not isolate. Okay, yeah. So, okay, any info that you want that the medic cannot give you, like color, is it blue or whatever and all that, please ask your nurse and the nurse will give you. And maybe if I heard that like other things like, you can't measure or something like that, things that you can, like the breath sounds, you should actually get it from the mannequin. Alright, okay, but otherwise, yeah. Okay, any questions?
Can you like clean up the patient in the sense that like take the pillow off and stuff?
Yeah, do as you would in real life. Okay, you don't have to turn him or anything like that. It's probably not required in this scenario. Okay, so I'm going to give you few minutes of huddle time. Alright, maybe 2 to 3 minutes, and then once you're ready, we will start. Okay, so maybe you want to have the huddle time outside? Have a discussion, about your huddle time, and then we start.
Should be okay. The scenario itself should be around 10 minutes.
I think so. I tak perasan how long we took,
Just now.
I think more than 10
about 10 minutes.
About 10 minutes.
I think 10 minutes.
Yeah, because the browser haven't run. They will need a few minutes to really get into the story. So that's why when we wrap it up, we cannot wrap it up too fast. So they need some time to imagine this is real, immerse in there. After the scenario.
Sorry?
Before the scenario.
Not yet.
Oh, after the time.
Yeah.
Wow. Oh, just now I forgot to talk. I forgot to talk in this.
When? Oh, okay. Maybe you also need to cover that. They didn't press this one.
Yeah.
You forgot to tell them. And when they come out, tell them about this one. Okay? Alright, come. I've got to show you another, the sync button is also here. The sync button, synchronize button. Okay, alright. Okay, so I'm going to introduce, we haven't started yet. We're going to, okay. So this is the emergency department. It is 9 p.m. at night. The patient in the scenario is Mr. Daniel. He's a 65-year-old male. The patient was brought into ED by Dr. Sarah. Patient has a background history of hypertension, type 2 diabetes mellitus, and ischemic heart disease. He was informed 3 months ago that he has advanced kidney disease and will require dialysis. However, he has refused and defaulted follow-up. He has been feeling increasingly weak and unable to walk for the past 1 week.
Also notices some leg swelling, feels a bit short of breath upon lying down, and has been sleeping on 2 pillows. She has just arrived into the emergency department on a wheelchair with his doctor. When you arrive into this room, this is an emergency room and we are part of the whole hospital. Alright, okay. He has just been transferred onto this trolley. His doctors are with him and the nurse is just about to put on the monitors. Alright, okay? Please start now.
Maybe you actually.
Hi doctor, so we have this patient, his name is Daniel and he's not really feeling well right now. So about take his vitamin.
Doctor, I can't breathe. I can't breathe, doctor.
Oh, okay. Can you tell me,
My heart
is he blue?
No,
beating so
He's not.
fast.
Okay, but okay, you cannot breathe. Okay. Can I understand?
It's like going to pop out, doctor. Please do something.
Can somebody pop out his bed a bit more?
Oh, it's suddenly cannot breathe. Okay. How long ago?
No, like pop out.
Please do something.
When did the breakfast start? When did your breakfast start?
I think
The SpO2 is 93, then we
Okay.
should give
Yeah, we should give
additional
as.
Doctor,
Face mask?
what
Do
oxygen?
something, doctor.
Single face mask.
The simple face mask.
Simple face mask, which one?
Can you tell me when it started?
Just yesterday.
Yesterday. Do you feel any chest
How many
pain?
liters you want to give?
No.
No chest
6
pain.
liters.
No chest pain.
Can we get a venous blood glucose very quickly?
Doctor, I feel very giddy.
What do you need?
I feel I'm going to faint.
Okay.
How many liters you said?
Okay.
6.
Is potassium high?
Oh, it's high.
Can we start?
Doctor, I cannot take it anymore, doctor.
Maybe we start.
Doctor, I cannot take it anymore, doctor.
Okay.
My heart is going to fall out soon.
Should we get an ECG as well?
Yeah, ECG attached.
Okay. Oh shit, this is SVT. Unstable SVT. Let me check your pulse.
We can assess the patient step by step.
But unstable SVT, which is sedate and start and synchronize cardiovascular, right? Can you lower down a bit?
Yes. Excuse me?
Doctor,
Okay, now what we're gonna do is we're gonna apply a shot to your chest, but don't worry, we're gonna put you to sleep first, okay? Is that okay? Is it okay if we put you to sleep and then we kind of put a shot?
Sarah, please do something,
We
Sarah.
start IV line, got IV line.
Sarah, I'm very pain.
Give
Sarah,
option.
Are you okay? Are you okay?
Midazolam, yeah.
Sarah, daddy hurt, daddy so pain. Please ask the doctor to help me.
Where are you pain? Where you feel pain?
Miss, you have to give us some
Doctor,
space.
Sarah, please tell the doctor to stay here, Sarah.
Him right now. I'm so sorry. We have to.
We want midazolam.
How many?
Just draw.
10 mg, 1 ml. We're gonna put you to sleep, okay? Then we're gonna give you some pain medication right now. And we're gonna
Yeah,
give
please,
you
doctor.
You guys want to prepare the defib first while she's drawing? Okay.
Please, doctor.
SpO2
10 ml midazolam, 10 ml
Should we change to a rebreather?
Rebreather? No, we don't need to ban.
you go ahead.
No, like a rebreather.
Okay, rebreather.
Should we change to rebreather? So like this.
Okay, can.
Okay. Okay. Until we're gonna change your mask to something stronger.
Since
Are you okay?
Okay, I'm increasing the flow.
Sarah, please help me, Sarah. Ask the doctor to do something. I'm very pain.
Help him ah.
Okay, we can help
We're doing our best to help him. Can you give him some medication? Yeah, very painful. Is it okay if you just step aside for a second? Don't worry, he's in the best
So
hands.
sorry, am I stepping aside? Thank you.
So I'm so sorry, ma'am. Do you mind just stepping aside for 1 second? I promise he's in the best hands.
But my father's calling me.
I know.
Doctor, are you still
Sorry,
pain,
ma'am. We're going to be doing a
doctor?
few procedures. Have to ask you
Can
to
give
step
him some
aside.
medication, it's still very painful though.
Squeeze the patient. So we're gonna be exposing you and giving you some
Okay.
treatment.
And then give
okay?
morphine. Morphine. You feeling better? No more. Are you feeling better?
The hospital too is still dropping.
Can you still hear me?
Would
Can
you
you still
like
hear
to?
me? Still how much?
Okay lah, Papa.
Okay, are you okay?
I cannot tahan, doctor.
Okay.
I cannot
Okay, better.
take it anymore, doctor.
Okay lah.
I cannot take it anymore.
Okay, you're gonna go to sleep very soon, okay? Don't worry.
We should
we're gonna
sedate
shop.
and synchronize.
Yeah, that's what we're doing.
Okay.
We given already.
Morphine given.
Okay, let's go.
Okay, we're gonna start soon.
Is he sedated?
Should be
Everyone
sedated.
clear?
Got the gel pad?
No,
Go to the gel pad.
Step aside this.
Is he going to be fine?
He's gonna be absolute. Wearing his best hand.
But he's suddenly not reactive already. Whoa.
Okay,
Okay,
okay, we're gonna
put
put
him
it.
to sleep to help train him better.
Perhaps you want to take a
Perhaps,
over here?
perhaps you can make yourself comfortable in the
Is
meantime.
it alright if you accompany him?
Oh, but it turned into refit.
You guys want to keep her out?
I think that would be best.
You will keep the
It's
chest
just
up.
It turned into refit.
Okay. Is
Okay.
it cough?
Okay, refit not lah. But here is refit.
Why is it not? Why is it not synchronizing?
Okay.
Clear,
Everyone clear?
clear, everyone clear.
Okay, charge ah.
Please, please. Clear?
Charge,
step
ah.
aside.
What are you guys doing right
Okay,
now?
can somebody help me press charge?
You press that.
Ah, press that.
You press that.
Okay, delivering shot now. Thank you.
Clear.
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 Okay.
Future shot.
No? Yes. Okay, gonna check the pulse.
Pulse?
Okay, pause.
So can you still hear me?
SpO2 going down.
Oh, I think we have to start CPR though. There's no pulse anymore.
No pulse?
Huh? No pulse
Please
already?
pause.
There's pulse.
Please pause.
Wait, he's still awake.
Okay, he's semi-awake now.
Oh, doctor. I'm still not feeling
We
well.
have to give more midazolam.
Midazolam,
Maybe.
midazolam.
You guys
I'm still not feeling well, doctor.
out first.
Yeah.
Yes, yes.
If you like reduce kind of.
Just
Okay, miss. Can I have you stand outside for a moment?
I'm so sorry. We're gonna
Sorry
be.
about this. We will do
You're
that.
going to save my father?
Yes.
Is my
We
father
will do
So can you still hear me?
We'll do our best.
giving me that dollar?
Midazolam given.
Yeah, dollar given.
SpO2 dropping 91.
Should we change to? Oh, but this is refillable already, right?
Yeah, readable, but there's no improvement. Should we?
You guys want to shop position again?
Guys, can you look at the ECG, please?
But the ECG is behind it.
But it's not stable.
No, use this.
Use that one, use that one.
Pulses.
Use that one.
Okay. Stand clear.
Okay, I'm gonna shot now. Thank you. Delivering 200 joule.
Yes.
Clear.
Shot delivered. Shot delivered.
Let's check. Okay, SQL increasing.
Yes, improving.
Heart rate.
So can you still hear me? Can you still hear me?
Situation.
I think the patient's heart rate not good.
Okay.
Okay.
Is this defib?
Check pulse.
But there's pulse though.
No, this is VTEC.
I think you.
Okay. There's no more pulse in you.
No, how's that? That's
This side.
any
Got
pulse?
it. I think got it.
Got pulse?
No pulse.
Doctor, I think we just start CPR.
Yeah, start CPR.
Okay.
Okay, I need to be.
Need to intubate the patient.
You need to intubate?
Yeah, intubate.
Okay.
Can we call for more help? Can we call emergency?
What are you guys doing?
Okay.
Sorry, miss. Sorry.
Is my father
Miss?
okay? Papa! Papa!
Emergency team.
Papa! You okay
Okay,
ma?
so run the BB, so I think.
Okay.
Papa, you okay ma? Miss, could you
Sorry,
be
can you
outside
help
for a while?
us? Sorry. We're gonna resuscitate him right now. Don't worry.
He's breathing his ribs though.
Don't worry. We're gonna
You guys
talk
should
to
have
you a
talked to
bit.
me a bit. Then after you guys get
Can you?
He was okay, that's not
Yeah, he will be okay. He will be okay. Okay.
You should have.
Just give us. Yeah. Can you please
Help us
help
keeping track of the fact.
Is anybody timing?
So after 4 cycles, it's 2 minutes.
Same thing. Can you please pass me the?
After SPO2,
We have to quickly just start with back mark first. Back for at least 3 minutes.
Oxygenate him first.
Connect to oxygen. Connect to oxygen for
Can you tell me how many CPR?
10 to 100.
Where's the oxygen?
Here.
Yes.
Here, there's stool, please.
There's no stool.
Oh, can you pop the bed over? Okay, good.
Put the bed lower.
Can you? Can you please count the CPR? Two.
You think this side's okay?
Bigger one. No, I think 你可以站着。
Okay.
Where's the
shoulder. How many did? You have to count the D and then.
4, 5,
Do we have to defeat the patient?
Yeah, I know.
10, 11,
There's no guide wire,
14, 15, 16. I do not
Wait,
know.
guide wire I can have.
1,
No.
2,
Sorry, you continue.
Okay, I think we use this. We use this.
5,
Continue.
6, 7, 8, 9, 10, 11, 12, 13, 15, 16, 17, 18, 19, 20, 21,
How long is it?
22, 23, 24, 25, 26,
30 seconds already.
29, 31,
Just 1 minute.
30, 1,
Hey, what is this easy?
Okay, stand clear.
Thank you.
Stand clear.
Short, delivering shot.
stand clear.
It's short on
Shot delivered.
Okay, what's the...
Continue CPR.
I think you can use the other leg actually.
Continue CPR.
1, 2,
on the bed.
3, 4, 5,
We need to crack
7,
again,
8, 9, 10, 11, 12, 13. Guys, the SPO2. 33, 34, 35.
I'm gonna clap adrenaline.
Okay.
You know, back in mind, every 6 seconds.
Prepare for intubation, not laryngeal muscle.
Straight in.
Prepare
Every
intubation.
6 seconds. There's no wire.
Intubation? You guys have intubation? Okay.
Maybe you have to be very quick. You just try to intubate
Just
first.
force it in.
Okay.
Can? Okay.
Can this really?
Maybe here. Oh, sorry.
Here.
Hey, down. The tripod.
Movement.
Can you try ventilating and I'll try and listen.
Okay.
Do you inflate the balloon?
Okay, balloon.
There's something to inflate or not?
Syringe on the table.
Just use it.
What's happening?
Syringe there.
What's happening? What? Oh.
What's the normal
active
syringe?
change is it?
Jerry, I think you stand here so Sue can stand there.
So can you help me please? Hold this
Okay. Try pumping.
Yeah.
Okay, pump again. Pump again. Pump again.
The 5
Pump again.
Okay.
I think got capnography. Got capnometer. No. Try again. I think it's a third. I think it's a third. Okay, start 6 seconds. I'm gonna
Okay, it's every 6 seconds.
continue.
Don't press it.
Yeah.
2, 3, 4,
It's okay, it's
5,
just
6.
reset.
Guys, the SPO2 is not showing, huh? 4, 5,
Pulse is 0, we need defib.
Okay, I'm gonna charge the thing.
3,
Okay.
4, 5, 6.
Okay, thank you everyone. I'm gonna do. Okay, delivering shot.
The balloon done already.
Okay, shot delivered. Continue CPR. I don't want it to. I want it.
Okay. Alright, so we stop. Alright, the patient will be successfully resuscitated and we will receive urgent dialysis. So just stop there. Yep.
Patient survive.
Okay, that's alright. I think you get too tired doing so many rounds of CPR. Okay, so actually, so the patient will be okay. We'll go to ICU and get urgent dialysis. All right. Okay, so I just need to quickly debrief you before we move on to the So how did that go?
Could have been done better.
Could have been more systematic.
It's okay. So what do you all think went well? What did you do well during that? What was you know?
We communicated.
We could read the rhythms, communicate.
Okay, give some examples of your communication.
We delegated our jobs.
Okay.
When I was giving the drugs, I informed that I was taking a drug, giving the drug, and then the drug was given. So I told it to the leader and
All right. Okay. All right. So okay. Anything else? Sorry, was there anything?
I think the leader gave out the work quite well also because she was in charge of breathing, then he was monitoring the attitude good, and then she knew when to start intubation and when to sort of like on to the next steps.
Okay.
And then he also could continue with the CPR then. So
All right. Okay. So I think I noticed that were you able to recognize the rhythms? What was it? The first round? The first one. What was it?
SVT, supervision.
Was it broad complex or narrow complex?
Narrow one.
The first one.
The first one was broad complex.
the first one was
immediately.
Oh, okay.
Yeah, it was broad complex. Yeah. So what was that?
ventricular.
VTAC. So it's versatile VT, right? Okay. Patient was still conscious. So it's good that you didn't try to defib or CPR the patient, right? Okay. All right. Then what was the second rhythm?
SVT, right?
No, there was no
because
SVT.
no pulse.
The second was narrow complex. So the second was actually atrial fibrillation.
Oh, okay.
All right, still hemodynamically unstable. All right, and then the third one was that's when that was a pulseless VT. All right, okay. And then there was another rhythm which was Did you notice that it went sinus at one point?
Yeah, I don't know what that is.
Yeah. So sinus, but you didn't start CPR because there was no pulse. Okay, fine. So what do you call that rhythm?
Pulseless electrical.
Okay, so there was pulses electrical activity, right? Okay, and then the last one was it was supposed to go to a VF at that point in time, but I think it was okay. The decision to continue chest compressions was correct. It's only that the rhythm, if you had declared that would have been better, the PE, pulse electrical activity, right? Okay, so I noticed that you were noticing what you were saying, back valve and mask, don't try to intubate. I think that was a good decision to ensure that the oxygen was connected. That was very good. You were also talking about you were managing the environment to ensure good quality CPR. You put down the head and then noted that the bed was too high, too low, and or that was good. And you also handled the doctor. You do need to get the doctor out of polite courtesy. You need to wait outside for a while. Okay. Did you need for Sean to suggest that to you, or did you manage to work that out?
I think Sue mentioned to take the patient out.
I think we suggested to try like getting the distance, and like we didn't know if we were allowed to put the patient.
They suggested, but they didn't do action.
Okay. So no, it's actually you can actually get you're supposed to take charge of your environment because in there you need to focus on the patient. Alright, okay. So eventually you did push it out. So that's good. Alright, okay. There was some sense of trying to keep you saying about keeping time, but during the chaos after that, we forgot about who was to keep time. So maybe that is a bit maybe that you might need to delegate, or you can use a device, or you can use a clock or something like that, right? Okay. So that was what was done well. Rosa, nak tambah anything?
I think you did mention that you mentioned the drug dose and things like that. But I think it could have been said louder, because it was hardly audible. And also, I think the drip you didn't actually put it out.
You did not want to put it out? You don't? Did you flush? Okay, that's right. Okay, so no. I mean the good observation. Anything else you add?
I think
What was done well?
What? the good thing is I think you handled the doctor quite early. Only that I think perhaps you could have been more assertive in getting her out of the room.
Okay. So what do you feel you could have done better?
The ECG readings.
Okay, so we need to have, this is a difficult one even for doctors, doctors who are already in the clinical environment, because it is so you need to revise the various rhythms and be able to recognize, and I would suggest declaring them. Just declaring.
Okay.
You need to declare to the team, because someone might disagree with you, and you do need to, if someone disagrees, you need to decide what it is, because it will depend on what you're going to do next, right? Anything else, you think you could have done better?
Could sedate him faster.
Yeah.
Oh, actually, I wanted to say, I'm very impressed that you remembered to sedate him, because we were prepared that you're going to shock him without sedating. What was that? Okay, so that was good that you sedated and you waited until he was, yeah. Okay, so okay, so you're saying that you took some time, because actually, this is a new environment for you. You've never managed the situation before, so I think it's good in real life. What I mean, So I think it's good that you remembered to give the sedation. Alright, okay. Anything else you think you could have done better?
The oxygen therapy.
Okay. So what do you think was the way to manage that airway? What was the correct thing to do?
So initially, when the patient was conscious, like semi-conscious, like maybe if the SpO2 was above 95, then simple face mask would be adequate. But then it started the breathing. Then we decided to do the non-rebreather mask.
Correct.
But then the patient's SpO2 went below like 94 to 92. So I think the cause for because they were doing chest compressions,
but during that time you have to back the patient.
Back valve mask. We were doing back valve mask. I think there was one point that we couldn't see the SpO2 maybe because of.
I think because like when the patient was semi-conscious, we forgot to put in like an oropharyngeal airway.
But when he was unconscious, there will be no SpO2 because there is no.
There's no response.
There's no pulse.
The
pulse oximeter will depend on the pulse.
Oh, okay, I didn't know.
That's a little bit concerned.
No, releasing cardiac arrest, you will get the SpO2 reading. Because there is no pulse. Okay. So he did go into cardiac arrest, but maybe what I want to say is that, do you actually know how to intubate someone?
I do.
How? But I can't imagine you've done it too many times. Is it absolutely essential in the management of this patient?
No, back valve mask is
correct. So you do need to take charge of the area. That doesn't include intubation. Alright, what else could you have done? Yeah, you could try LMA. So in fact, for non-anesthetists or people who don't normally intubate, the safest thing is to just stay with the back valve and mask and do synchronize. Right, 30 to 2, 30. You don't actually have to intubate the patient. Alright, okay. And if you can't get effective, then the next, I think LMA. The thing about intubation that is very easy to make it go esophageally. If and it can be quite difficult. So I think the best thing to do is to not it's our only photo of us, not not the participants. So so we need to stop. Alright. Okay. So I think. Overall, I think that's. I just needed to get that bit across, and I think alright. Okay, so I hope you learned from that. Thank you. Alright, okay, so thank you.
Thank you.
Thank you.
Get your stuff. Okay. Alright, okay.
Thank you.
Alright, okay.
Next one, then minus
What drop? Okay, we should. But can we just ensure the next group of all their variables are. You drop some.